Hi YouTube, welcome back to my channel. My name is Shanae Monique and this video has been long awaited. You guys have been asking me about this video on Instagram. You guys have been emailing me, commenting, and it's finally here. So this is my review on my breast lift. It's been over a year now since I had my breast lift. I had it last year in, I believe, October, right before Halloween. So it's been well over a year. I really wanted to wait a little bit longer to do a review for this procedure just because this procedure was a little bit of a roller coaster for me with healing. It's not like lipo or BBL where you have instant gratification of a snatched waist and a big butt. It's more of a really long healing process, and it also, your results don't look great right away. It takes some time, but we'll get into that in a little bit. So I just want to kind of go into detail with some information, have it written down so I don't forget anything. I just wanted to give you guys like the exact details on my surgery before I get into opinions and things like that, and like some of the most frequently asked questions. So I had a Brazilian, oh my gosh, I had that, yes, but we've already talked about that. So anyways, I had a breast lift in last year, October of 2018, and oh no, that's the wrong year. October 2017, excuse me, with Dr. Jason Altman. If you guys want to follow him, he's on Instagram. He's an amazing doctor. He works out of the Plastic Surgery Institute of Miami. They also have a Yelp page, so you guys can find their Yelp. He has a Real Self page, so you could look him up on Real Self. He has tons of reviews on there. And then his phone number is 305 area code 446-7700. And also you can email for a consultation at Dr. Altman, spelled ALTMAN, at psimiami.com. That's how I got in contact with him, and he actually does email you back, so you're actually talking to Dr. Altman himself. Also be advised, give him a couple of days to respond back. Obviously, he's a busy surgeon. He does surgeries, he does consultations. Not only does he do surgeries, he also does injections. Like, he's a full plastic surgeon doctor, if that even makes any sense, you know, whatever. So he's busy, but he will get back to you himself. So feel free to ask him any questions. Also, I advise to send pictures because obviously he wants to see what you're working with so he can kind of assess you without having you to have to come into the office. Oh, okay, sorry. Anyways, so just a little bit of background information on Dr. Altman from what I know. Obviously, this is not a sponsored video. I wasn't paid for this. I didn't get free surgery. I paid just like everyone else, and I did my research to find him. So what I know about Dr. Altman, he was featured on Wags Miami. He's done tons of big celebrities surgeries. From what I know of, he's done Shanika Adams, Tammy Rivera, who is Waka Flocka's wife, Lyra Galore, who is known for a lot of things, Jerica Carleo, I don't even know how to say her last name, but she's not Slim Thug or whatever his name is. I forget his name. Babe, what's that guy's name that is always with Lil Uzi Vert? And he has the lip ring. Who's that guy that's always with Lil Uzi Vert and he has the lip ring? And they're always like dressing up really weird and girl. Young Thug. So she's young. I can't believe I just went off on a rant on that. But she's Young Thug's girlfriend. Aisha Diaz, Kamaya Adams. So a lot of Instagram famous women he has done. And then of course myself. I'm just kidding. Anyways, that was a little much. But so he's done a lot of popular people's surgeries. So a lot of women have trusted him with their surgeries. He's known as the boob god. Like, his specialty are boobs. Like, anything that you can think of boobs, Dr. Altman is a doctor, but he also is a great surgeon. So he's just very well-rounded. So a little bit of background on how I found Dr. Altman. I have always wanted to get my boobs redone. If you follow me and have followed my plastic surgery journey, you know this is my third breast augmentation. I originally had 450 cc's, then I went up to 800 cc's, and then this would have taken me back down to, I believe, 550 cc's with a lift. So because I went so big my second time going to 800 cc's, and then after that getting pregnant with my daughter, my boobs got so big and my areolas got huge, and then they just dropped. So it was super heavy on my back. They just were huge, big boobs that were uncomfortable. They sagged, they didn't look good. If I could show you the pictures I sent Dr. Altman, like just looking back at that email, I was like, oh my gosh, my boobs were huge. Obviously I can't because I was exposed in them, so I can't show you guys those pictures. But if you look back on some of my pictures all the way down in my Instagram, go as far back as you can see the transition from my boobs now to my boobs prior. And they just, going smaller just really just makes me look all around a lot slimmer. Having really big boobs makes you look top heavy. It makes you look bigger than you really are. So the change in how I look as far as a smaller frame, definitely I would give that to getting smaller boobs. So how my journey started off with finding Dr. Altman, I originally contacted my second surgeon that I went to get the 800 cc's. His name is Dr. Gray in San Francisco. He's a really amazing doctor. I love my second pair of boobs. It was just that I went way too big, and then the combination of getting pregnant soon after that and my boobs enlarging even more and then shrinking back down, it just created a lot of sag. And obviously I'm not getting any younger, so it just created a lot of tension on my breast tissue, and it just did not give me the look that I wanted. I know a lot of women suffer from just having naturally really big boobs. So even if you don't have an implant and you just have suffered from, you know, breastfeeding and the sag that comes after that, definitely doing a breast lift is something that I highly recommend, because you'll get that fullness and that lift back. But anyway, so I contacted my doctor in San Francisco, Dr. Gray. He explained to me that he doesn't do a full anchor breast lift. So a full anchor, there's 3 different breast lifts. There's a Benelli, which is just an incision around the nipple or the areola. There's the lollipop, which is exactly how it sounds. It's the areola and then a straight line down, so it looks like a lollipop. And then there's the anchor. So around the areola, straight down, and then under the breast fold, so it looks like an anchor. And it also just goes by phases of sagging. There's like a medical term for it. I wish Dr. Altman was here to help me. There's a medical term for it, like ptosis, something like that. I'm not a doctor, but so the first one, Benelli, is for women that have very mild case of sagging, like very little, and you just want to kind of reposition the nipple. I wouldn't suggest that one because from what I've seen, you get a lot of scarring around the nipple because of the tension that is used to hold the breast up. Also, what I've seen from that one is they don't tend to hold as long. So the breast lift isn't necessarily a long-lasting breast lift. Over time, it starts to get saggy again, and who would want to go through that again? So that one is the first one. Then there's the lollipop, which I think is like the second most popular lift, and that is the one that Dr. Gray said that he only does. And that sounded good to me at first because that's one less scar underneath the breast fold. But when I did my research, from what I read, I definitely needed that extra anchor at the bottom to give me the lift and look that I wanted because I had so much breast tissue. And also he quoted me a really obscene amount for the breast lift, and I was just thinking, I'm a returning patient, so I could only imagine, you know, anyone that was new, if that was even a discount. Like, it was close to $18,000, and I'm not hating on his price. I shouldn't even be telling you guys his price, because that might have changed now, but that's what he quoted me, and I'm gonna keep it real and honest. I am a patient of his, so it is what it is. He was just way too expensive for me, and I was just like, yeah, no, I'm not gonna pay $18,000 for a breast lift. Just not gonna do it. So crossed him off the board, and then I started doing some more research on Real Self, and another name popped up, and his name is Dr. Poutsi, I believe, Poutsi something. I'm so bad at names. I'm so bad, you guys. I'm so sorry. But I know you guys have heard of him. He's based out of Southern California, I believe, in San Diego area. He's a really amazing doctor who specializes in reconstruction. So just any kind of complication with breast surgery, he's really amazing at. And also just boobs in general. So that's what prompted me to look up him, just based on the hundreds of cases of reconstruction he did. So I reached out to him via email, and we emailed back and forth, and he let me know I would need a full anchor lift. So that just reaffirmed me not going with my other doctor. And then he quoted me a price of either $85 or $89. I know it was something with an 8. And so that was more reasonable for me. I felt like that was a reasonable price. It wasn't something that was alarming, and it wasn't something that was super low to me to think like, oh my gosh, am I not investing enough money into this? So the more and more I did my research on him without making like a decision right away, in my heart, I didn't feel comfortable booking my appointment with him for some reason. I don't know if it was the lack of detailed communication via email, and I don't want to judge anything based on that, because again, they're doctors, they're super busy, they get hundreds of emails a day. I guess it was just, I didn't feel that comfortness, whatever. I didn't feel that connection with him to feel comfortably enough to move forward and book my surgery. So I went ahead and pushed him kind of to the back burner and continued my research. Real Self is like a lifesaver, you guys. If you guys are interested in plastic surgery, please do your research on Real Self. It really is exactly what it is. Real Self, real people explaining and going into detail their surgery journeys, and you get pictures, you get reviews, honest reviews. These aren't off of a doctor's page where they're just putting their good reviews. This is the good, the bad, and the ugly of plastic surgery. So yeah, I went back to Real Self and I just typed in breast lift, and then I pulled up my next doctor, which he also is a very popular doctor, Dr. Hochstein. I'm so bad with names, you guys. I'm borderline remedial. But so he is Lisa Hochstein's husband, Hochstein, whatever, and she was on the Real Housewives of Miami. Very beautiful couple. She's so great. She's always talked about their med spa on their TV show, and he's always been on there. Lenny, you can hear about him on the show. And they have a practice in Miami, and he's also known as the Boob God. And from what I've seen, he does amazing boobs. He does amazing breast lifts. And from what I saw, I was like, oh my gosh, this is my doctor. So I proceeded to email them, and they gave me a quote of, I believe, $8,000 as well. So really good pricing. I would have to travel to Miami, which is totally fine because I'm not a stranger of traveling to get my surgeries. And I emailed his coordinator, and I was comfortable with booking my surgery until I saw a post from Shanika Adams about her breast lift. Okay, so she recently, around the same time, got a breast lift with Dr. ALTMAN, and she had really severe saggy breast. When I say really bad sagging, and she didn't have an implant. But when I saw her before and afters, I was like, this is the doctor I have to go with. And not because her breasts looked so good, but for the simple fact that I'm African American and she's African American. And to be quite honest, African American skin scars completely different than any other skin type, tone, anything. Just because of all the melanin in our skin, we tend to have hyperpigmentation. We're prone to keloids, we're prone to hypertrophic scarring, we're prone to a lot of scarring, fat scarring. And with such a big surgery where I would be getting a cut around my nipple, straight down my breast, and completely from my corner to corner of my breast fold, I wanted to make sure my main thing with my doctor was my scarring. That is the biggest scare for me, was the scarring. I've had trouble with scarring before with my other breast augmentations, and those were just little, maybe an inch to inch and a half scars and incisions, and I always tend to keloid, or so what I thought was keloiding, but what I've learned now is called a hypertrophic scar, which is where the scar is within the confines of the actual incision and it doesn't bubble out like an actual keloid. It's just raised and very inflamed-ish, and but it's still within the confines of where the surgeon had cut. So I'm just prone to stuff like that. I've had steroid injections into my scars before. I've had to get them cut out before. They just tend to bubble up and they're not pretty. So I wanted to make sure I found a doctor that was familiar with African American skin and doing surgery on that. And I know that sounds a little, you know, whatever, but it is what it is. So when I saw that she had amazing results from him, that just kind of put him on my radar, and I started doing my research about him. And what sealed the deal for me, excuse me, I have a lash in my eye. But what sealed the deal for me about Dr. Altman was when I emailed him, he emailed me back maybe within 24 hours or less. And when I tell you he went into depth about every question I answered, it was kind of a feeling that I've been waiting for, on just feeling super comfortable and trusting someone and him understanding exactly my main concerns and what I wanted. I explained to him that this would be my third breast augmentation. I wanted it to be my last. I'm tired of messing with my boobs. It's been a long process. Anyone that's ever had their boobs done before understands this. I feel like it's just one of those things that you have a vision of how you want your boobs to look in your head, and when it doesn't happen and when they're not the way that you want them, it's very emotional. It really is. I know it sounds crazy and very emotional beings, but it is. It was very emotional for me, and I wanted this journey with my boobs to be over. I wanted small, perky breasts, and you know, I didn't want crazy scarring. So, but you also have to be realistic about the fact that you are going to have scars. The degree of how severe your scars end up all depends on your doctor, post-op care, products that you're using, and it just all depends on a bunch of different factors. So keep in mind in your head that you're going to have scars. But the trade-off for me was the scars were worth the fact that my back no longer was gonna hurt. I was gonna look great in bathing suits, great in clothing. I was gonna look slimmer. I was gonna have perky breasts. And to me, that was worth it. So you have to figure out what you're doing this breast lift for and see if it's worth the trade-off. So Dr. Altman answered every question to me. I don't mind pulling up the emails from him because he is amazing. So I'm gonna read the email to you. I emailed him 9/21/17. I said, "Hi, Dr. Altman. I've had 2 prior breast augmentations. First with 450 cc's, second with 800 cc's with scar revision. Now I'm looking to downsize back to around 450 to 500 cc's. I feel like my boobs are way too big and heavy and saggy. My biggest pause is the scarring from a breast lift due to the fact that I've had a BBL and the small lipo incisions have turned extremely dark and raised. And I'm so scared of that happening to my breasts. I have researched your work and love your results. Can't wait to hear back from you. Thank you for your time. And then I attached some pictures with them. These pictures are crazy. I wish I could show you guys these pictures. If you guys are women and you're really interested and you email me or DM me, I can possibly send you some censored pictures to see how bad my boobs are. So anyways, Dr. Altman replied, so mind you, that was the 21st. Okay, so I lied. It was a couple of days after, but it didn't really bother me. It was the 26th when he emailed me back, and he said, I'm just checking my camera, making sure everything is still recording. So anyways, this is his email back to me. Shanae, it would be my pleasure to take care of you. I can certainly understand why you would like to downsize. 800 is just too big to carry around for too long. You are correct that you would need a lift to deal with all the excess skin and support the new, smaller implants. The scarring should not be anything as bad as the lipo scars. Liposuction scars tend to get dark and irregular because the liposuction itself damages and traumatizes the skin. All the friction from moving the liposuction canal back and forth can literally burn the skin and cause that darkening. Breast incisions are precise and not traumatic, so in my hands tend to heal much nicer. Thin lines with similar color to the surrounding skin. Well, hey, that's exactly what I was looking for, right? So let me see. I'm just gonna go through everything. And then he directed me to his surgery coordinator, whose name is, excuse me, I'm reading through emails. Surgery coordinator named Karina, and he said, Karina will take care of everything. I'd like you here a full week if possible, but many patients feel comfortable leaving 3 to 4 days. No recovery houses. Karina will help you with local hotels we recommend. So I never really was a fan of recovery houses, so that really wasn't a big deal to me when he said no recovery houses, because even with my BBL, you guys know, I didn't stay in a recovery house. Just don't like the concept behind them, I guess. And so whatever, that wasn't a big deal to me. So I found a hotel, booked my flight, and I messaged his surgery coordinator, Karina. She is literally amazing, the sweetest thing. You'll meet her if you book your surgery. Like, when I tell you, super sweet. Like, we follow each other on Instagram. It's that deep. Like, she's so sweet. I did my $1,000 deposit. Oh yeah, $1,000 deposit. And the surgery itself, when I did it, I don't know how his prices right now, but when I did my surgery was $8,000. So you do a $1,000 deposit via email with Karina to hold your date and procedure, and then when you get in town to do your paperwork the day before, I believe, your pre-op, the day before surgery, you pay your remaining balance. And so that's when we did the $7,000 and did all my paperwork. You'll also get sent lab work, to do your blood work prior. Make sure, you know, all your iron levels are good, you're not pregnant. Just make sure everything's up and up, your blood work. So prior to surgery, which is pretty normal. I'm trying to make sure that I'm not forgetting anything prior to surgery. Yeah, everything prior to surgery is great. Just did my blood work. There's very minimal prep that you need to do for a breast lift. It's not like a BBL where you need a bunch of supplies, like a supply list. So I didn't grab anything. There's nothing really to prepare for, I would say. Yeah, so I really didn't do much preparing like for my BBL. So we just booked a flight into Miami. Actually, into Fort Lauderdale is a lot cheaper to fly into Fort Lauderdale from where I'm from. So definitely take a look at Fort Lauderdale, because it's literally 15 minutes away from Miami, and so it wasn't that big of a deal. I flew in for my surgery, I believe, I don't know what day it was. I just know I flew in the day before surgery. I had surgery the next day. So I got in late, and then because of Miami traffic and everything else, I didn't get to the office till after 6 o'clock, which another reason why I love Karina so much, she stayed and waited for me so I could do all my paperwork. The only downfall was obviously Dr. Altman had left, you know, he had to go. I understand, I was late. So I did not get to meet Dr. Altman prior to surgery, but obviously if you're on time for your appointment, you'll be able to meet him and shake hands and discuss and everything. But I did meet with Karina, his surgery coordinator. I got to go to the office and see, you know, how beautiful, how clean, everything. His office is inside of, I don't even know what it's inside of, but it's such a beautiful office. You could tell it's upscale, it's clean, it's new, it's fresh, everything. It's just not, it's completely night and day to where I had my BBL to here. And you know, that's just the nature of where I had my BBL. It was just like, you know, a shopping center. It's just like a chop shop compared to actual hospital grade plastic surgeon. So even though I love my BBL results and I love my Dr. Hassan, you know me, but Dr. Altman's office, for only honestly paying $8,000 for a breast lift, you would think it was the $18,000 doctor because it's beautiful. So anyways, I met with Karina, super sweet. She waited after having a long day at work. She waited for me. We did my paperwork, signed all the consents, paid the remaining balance. She gave me my prescriptions for obviously surgery, explained where I needed to go to get them. Just trying to make sure I didn't forget anything. Answered any questions that I needed. She let me know I needed to wear a zip-up hoodie for surgery and loose-fitting pants. Obviously nothing to pull over, so you're not, you know, messing with your boobs or incisions or anything. Something easy to pull down so you can use the restroom. So yeah, it was very easy, maybe about 15-20 minutes in the office. And then we went to Walgreens or CVS, wherever, put my prescriptions in, got my prescriptions. I don't remember if it was 3 or 4 prescriptions, but it was about $80 to $90. It was a muscle relaxer, pain medicine, stool softener, I believe, and maybe an infection, like an infection. So maybe 3 or 4 medications that I paid for and got. Super easy, nothing crazy. And then I went back to my hotel and prepped for surgery. I was scheduled for surgery, I believe 11 or 12 o'clock. I'm used to having surgery super early in the morning, so that was different for me, just because, you know, you wake up and the anticipation is lasting a couple of hours, opposed to just waking up and it's go time. So that was a little different for me, but washed up. I also think you need to get antibacterial soap, so when you wash like your incisions and stuff. So I washed my whole body with antibacterial soap. I didn't eat or drink. I'm not sure the hours prior to surgery, they'll let you know. And went back to the office, and I got to meet with Dr. Altman. We did do another pregnancy test, so make sure that you guys are not pregnant, because they will check. They do not play no games with those pregnancy tests. I was like, oh my gosh, they are checking me again. So, and y'all don't want no scares, you know what I mean? Like, you're all excited for surgery and they're like, oh, you're pregnant. So anyways, sorry, just kind of fixing this a little bit. But anyway, so everything was cleared to go. I met with Dr. Altman, such a nice doctor. When I say his bedside demeanor is just something of a doctor that is confident, knows what he's talking about, not cocky at all, super sweet and kind. Just someone that wants to make every single patient, no matter 100,000 followers, 2 followers, Insta famous, not famous, married to Bill Gates, not. He just wants to make every single person that trusts him feel comfortable, and that really meant a lot to me. He made me feel super comfortable. We discussed exactly what was going to happen in surgery. He let me know that what lift we're going to do, which was the full anchor, and he marked me with this little metal looking contraption that went around my nipple, markered it, and then also did some lines like this. So it looked like a keyhole. And from what I understood, he was going to take all that out and pull it together. And you see how that just lifts once you do that? Once you connect these two lines that would be cut out, remove the best tissue and lift. So that's kind of what I understood what was going to happen. He said the anesthesiologist was going to take care of me. We put on compression socks and it was time to go. So we went in. We had nurses. We had Dr. ALTMAN. He was there the whole time. He didn't walk away. He was with me the whole time. And the anesthesiologist is super nice, was talking to me, making me feel comfortable. And by the time I knew it, anyone that's ever had surgery before knows you're out like a light. You just remember being rolled in, and pretty much that's it. That's how a good surgery should go. You shouldn't be waking up in the middle of surgery feeling nips and tucks, and no, you should be out. And I know this sounds crazy, but surgery actually is very relaxing for me. It's probably the drugs, but it's very, very relaxing for me. So anyways, went through surgery, woke up. From what I remember and what I was told, Dr. ALTMAN let me know he was there. He waited till I woke up and he let me know everything went fine. We agreed on 500 cc's, but I guess once we got in there, he said 550 looked better and gave me a better lift, which I gave him 100% green light to do. Make sure you have that conversation with your doctor. Let them know once they get in there, give them a ballpark range. I let him know I wanted to go 450 cc's, no more than 650 cc's. So we got right in the middle, which is perfect. And you also have to understand that 650 cc's sounds like a lot, but when he's removing so much of your own natural breast tissue, you're removing a lot of mass, so you're losing a lot too. You know, it's not breast tissue on top of implant. He's removing a lot. So he said the 550 looked best. I was totally fine with that. I was like, great, good to go. Let's do it. I'm happy. Obviously, I was still a little groggy. And they told me that the nurse wanted to, wheelchair me out. And I guess I was like, no, I can walk. So they helped me out to the car. My boyfriend was there waiting. Obviously, you have to have somebody there to drive you. You cannot drive yourself. So bring someone that you trust. Don't bring a friend that's just there for a free trip to Miami or wherever you're going. Make sure you bring somebody that obviously is there for you, like your mother, husband, boyfriend, sister, somebody, because your aftercare, you're gonna need somebody, giving you your medicines, helping you use the bathroom, making sure that you're drinking, water, electrolytes, eating, helping you get dressed and stuff like that, because you honestly cannot move your arms too much. You just had a huge surgery with a bunch of incisions that you do not want to open back up. So the main thing that I would like to say about post-op for a breast lift, and I'm not sure if that goes for any other surgeries, but Dr. ALTMAN stressed that I needed to be, for the first 2 days or so, needed to be propped up to about, I think like, I don't even know what this is, 90 degrees or like 120 degrees, something like that. Just propped up. You can't lay flat on your back. I am not a math major, I don't know. So anyways, you just have to be propped up with pillows. So you cannot sleep on your side, you can't sleep flat, you need to be propped up with pillows. So that's another thing that you guys need to remember. It's very, 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 very important to make sure that you are laying sitting up. Make sure that you're taking your medicines every so couple of hours, however they are told to be dispersed to you. I'm not sure. I took my pain medicine regularly, so I rarely felt any pain. I don't remember ever being in like excruciating pain. But what I do remember from the day after was I was extremely bloated. My stomach was huge. I looked like 4 or 5 months pregnant. It was really, really bloated. And from the research that I did, it was obviously from the antibiotics and the pain medicine and all that stuff, and the anesthesia, whatever it's called, from when you went to sleep, that stuff, it just bloats you. So don't be alarmed about that. And so yeah, literally after surgery, I honestly didn't feel much pain. I also didn't lift my arms up too much. I didn't use my arms. I was like just walking like really, really stiff, arms down. So yeah, from also what I remember when I was looking at my boobs, how they looked, I had a surgical bra on that buttoned up in the front, and when you opened it, I had steri tape all over my incisions. So around my nipple, straight down, and then straight across. So all my incisions were covered up. I don't remember if I was allowed to shower. Oh, I was allowed to shower. So I was allowed to shower, and I was supposed to clean the incisions with antibacterial soap. Obviously not taking the tape off, but cleaning around it and then blow drying it on cool. So you want to make sure that when you get out of the shower and you have your tapes on, you want to make sure that you're drying them too. So we did that, and then you put your bra back on. And for the first time of seeing my boobs, I'm just gonna warn you guys, they look crazy. They really look, how can I explain it? They look like cones. They were very, very flat at the top, like a slope, and came to a point, just like Madonna cone boobs. They looked crazy. I kind of was like, what the hell did I do to myself? I was crying. I was just like, yo, my boobs are so ugly. They didn't look round. They didn't look good at all. And I hadn't seen my scars obviously yet, but the shape of my actual boob wasn't like having a traditional breast implant when they're nice and high and round and they just look great. No, they were high, but they was high and pointy and just crazy looking. So I was just like, oh my gosh, what the hell did I do to myself? I was online looking like, is this normal? Is something wrong? Blah, blah, blah. So I had my post-op appointment with Dr. ALTMAN right after, the day after. Went in and he looked and he said, everything looks good. He said, I know they look crazy right now, but trust me, don't look or judge your boobs right now. Give it 6 weeks before you judge your boobs. They have to heal, they have to form. So the best way I could describe a breast lift is the healing stages. The first 6 weeks, you have to understand your breasts, they're brand new. Your doctor had to literally reconstruct a brand new breast for you. Excuse me, I just keep getting things in my eye. Anyways, your doctor had to create a new breast fold. So the natural breast fold that you have obviously is curved. But when you're cutting and manipulating and creating a new breast fold, it's tight and it's tense the first couple of weeks because it's brand new. You have to kind of think about the actual implant dropping into its new pocket and forming that beautiful shape. That's the best way I can explain it. Just think about like breaking in new shoes, breaking in that leather. Everything has to break and soften, and just give it time, honestly, because it's going to look crazy. And the crazier it looks, honest to God, the crazier it looks in the beginning, the better they're going to look, because they're just going to form perfectly to a natural shape to your body. So, and I also purchased Dr. ALTMAN's scar cream that he recommended. sorry, I'm having a brain freeze. The scar cream that he recommended, I forget what it's called. I'll link it in the description box below, but it's a white bottle, serum, something like that. And he recommended using that after my steri strips came off. So, and once that was good. And I believe it was 2 weeks before I could take them off. So for 2 weeks, I was showering, cleaning with antibacterial, and then blow drying. And then 2 weeks after, 2 or 3 weeks after, I was able to take the steri strips off and start using scar treatment. And that's very, very, very important. You want to make sure you're using your creams. That's going to help prevent a lot of the bad scarring. You don't want to use the sheets, the silicone sheets just yet. I think you want to wait till they're fully healed before you start using them, I believe. But you can ask your doctor too. I'm not sure. I would just use the cream first once the steri strips come off. When I took the steri strips off, it was a little scary because there was certain areas that were opening up, like this breast right here, right under where the vertical line and the horizontal line met up, started to open up. When I asked about it and when I did research about it, that's pretty normal because that's a huge tension point for your actual incision. So over time it's supposed to heal itself. You're just supposed to keep it clean, put your ointments and stuff on it. So if that happens to you, make sure you reach out to your doctor, but it's pretty normal and it's healed it's healed just fine. So yeah, I'm trying to think, did I have any stitches? I don't remember if I had stitches. I don't remember if I had stitches. I think I did. I think I had stitches at the ends. I'm not sure. I don't remember. I'm so sorry. This is so bad. I don't remember if I had stitches, but I know I didn't have to remove anything. And that's just when immediate scar management went into effect. I was using my creams. You don't want to suntan. You don't want to tan your scars. That's what turns them dark. You don't want to mess with your nipples too much. You don't want to get an infection. You just want to keep them clean and follow directions of your doctor. So that's kind of how everything went with Dr. Altman. So the reviews I would give him as a doctor are, 10 out of 10, 5 stars. I would go back to him for anything. I truly recommend him as a doctor. So my review on the actual breast lift itself has nothing to do with him as a doctor and has everything to do with my body's healing. So now that I've talked to you about Dr. Altman and the procedure and how things went with me, the actual review about my boobs, I'm gonna kind of get into. So this is the juicy stuff. This is the good stuff you guys want to hear. Is it worth it? Yes, a breast lift is worth it. Again, you have to figure out your main goals that you're trying to have with your breast lift, and the trade-offs. Because I have scars. I have a scar around my nipple, I have a vertical scar, and I have a scar from here to here. Kind of show you how lifted and perky they are. Like, I'm not wearing a bra and they are super perky and lifted, but I do have scars. In the beginning of the healing, my scars were light, they were smooth, but then over time they started to build up that darkish brown, darkish black color in certain areas. And it's weird because it has no rhythm or rhyme to it. Like the scar from here to here, from this end, is completely light, flat, you can barely see it. And then the scar from here to here, light, flat, barely see it, very invisible. But then this side and this area is dark and raised and rigid. There's areas around my nipple that are dark, raised and rigid and very thick. And then the line straight down is very clean. It is dark and there's areas that are kind of, you can feel scar tissue building or whatever it might be. You could feel lumps and texture in them. The overall shape of my breasts are great. They're lifted and they're round. I love them, but I have irregularities in my scar that I don't necessarily like, but you can live with them, if that makes sense. What I will say is, in certain t-shirts, you can see the texture of the scarring around the nipple. So that is kind of, you know, you're self-conscious about that. It kind of looks like a sticker. You know, the actual nipple itself doesn't, you know, look like a stick-on nipple that you would think of. It looks very natural, but you can see it through, you know, clothing. For me, at least, that's one area of my boobs that I'm kind of like about. Maybe a couple months ago, I flew back to see Dr. ALTMAN, where we tested an area of underneath the breast fold where we did steroid injections. We did Kenalog diluted down, and we did a little section where it was thick and raised. It was so painful. When I tell you, I have a high tolerance for pain, but when I tell you, I had to go like this, and he did the injections into the actual scar itself. And when I tell you, there was no way I would be able to do that in all the areas where it was thick and raised. There's no way I would be able to do that. I was just like, let's test that out and see how it reacts. So maybe a month or so after, you started to see it decrease. It got really, really thin, and it kind of indented into my skin. So it went past the point of being flat and actually indented. And then it started to turn white. And now where I'm at in the healing stage of the steroid is it's evened out the dent, and it's come back to its natural skin color. So that's a process in itself, but it actually works. So that's what he likes to do as far as scar management for when it gets thick and raised. He likes to do the Kenalog injections, and he likes to do 1 to 2 to 3 series before they go beyond. Obviously, he would have to assess your specific scar himself to let you know what he thinks, but he suggests to do more Kenalog in the areas like around the nipple and things like that. There's just no way I would be able to do that just sitting down at office. There's no way. It hurts way too bad. There's just no way. Excuse me, I'm gonna sneeze. Excuse me. Anyway, so yeah, the scars are rough. I'm not even gonna lie. And I don't blame Dr. ALTMAN at all, because I believe that they look really, really good for what it could have been. Like, honestly, I've seen some really, really bad jobs, and my boobs look really, really good. It's just certain areas that need some attention. I don't know if they need to be cut out or what, but my body just reacts differently, and that's the chances you take when you have surgery. Like, his work is super clean, super neat. I love it, but you know, it is what it is. I have scarring. Figure it out. But am I happy with my breast lift? I'm so happy. You guys can tell by my Instagram, I'm always showing off my boobs. They're so nice. They're squishy. The only thing I will also say about, you do have feeling in your nipples, so he's not actually cutting the nipple off and gluing it back on or sewing it back on. The nipple stays intact, so you still have sensation in your nipples. But what I will say is the scarring around your nipples, for me, since it has gotten thick, it hurts. It really, really hurts. It's like sometimes I get this shooting pinching nerve feeling, and it does hurt. So just be very careful with like pinching your nipples on the actual scar and stuff. Yeah, but other than that, I love my breast lift. I would recommend it to anyone that's been thinking about it. The only thing I say is make sure you research, ask questions, make sure you're going to a board certified plastic surgeon, make sure you're looking at before and after pictures. You want to do your research, because you can't reverse something like this. You can't reverse the scars. Excuse me, that's my allergies in here. Excuse me. But you can't reverse your scars. You can't reverse the procedure. It's something that you have to be dedicated to. But I guarantee you 9 times out of 10, any woman that you ask that has had a breast lift will tell you it's so much worth it. So I'm gonna stand up. Let me move this out of the way. So you guys can see my actual boobs. Like side profile. Ooh. Let's get all this hair out of here. So they're lifted. They look really, really good compared to what I had before. Nice. Anyway, so lastly, what I want to finish off with is I've been in talks with Dr. ALTMAN about coming and doing some liposuction because I want to get rid of these arms. I want to get rid of this back roll fat. My arms are my biggest things. You guys know I talk about it all the time. I really want to get rid of my arm fat and my back rolls, and I thought, why not do that? And then he could do my steroid injections into it while I'm sleeping, pain-free. So we'll see how that goes. I haven't decided yet. I go back and forth with it every day. I don't know if it's worth it or not. I don't know. I'm trying to weigh out the pros and the cons. You know, I don't know if I want to pay for another round of surgery for lipo. Should I work out? You guys help me. What should I do? I need to know. I am just like, I go back and forth all the time. You know, I need to figure this out. But I hope you guys like this video. This is an initial review about my breast lift. Ask me questions. Make sure that you follow me on Instagram, Cheney Monique, CheneMonique. Make sure that you guys go show Dr. ALTMAN some love over on his Instagram page. I'm sure he'll love it. If you guys book your guys' appointments, let me know how it goes. You know, he's an amazing doctor. Truly, truly changed my life. Gave me the confidence again in my breasts. So yeah, and I'll keep you guys updated on scarring, how it's going. And it's been a year, so your boobs change over a year. It's gonna be a long ride and roller coaster, but it's well worth it. So bye guys. Okay guys, so I just wanted to quickly show you how my breasts look in a bra. So there's no padding on this bra. Obviously I can't show you my nude breasts, and I'm not going to, but this is how they look in a Victoria's Secret bra. I'm not oh, actually I'm a 36 double D or 32 triple, if that makes any sense. There's no padding, like I said, just underwire, and you're also not allowed to wear underwire bra, only your surgical bra or sports bras for the first couple of weeks, but make sure you check with your doctor. But yes, these are how my boobs look. They're very squishy. Look at the shape, just everything. They're perfect. I love my boobs. They're great, and they fit my body so nice. Love them. Also, you guys, I did get Kybella as well, but that's gonna be a whole nother video for review. So make sure you guys are subscribing to my videos and my channel. I'm going to be just giving you a bunch of videos on what I've been getting done. My fillers, I've got an update on my fillers, my Kybella, hopefully on these arms, getting some lipo, and then my scars. I'm gonna do an update once I figure out what I'm gonna do with my scars. So oh, I love my boobs. They're so great. Yeah. Thanks. Bye, guys.